One topic that I did want to discuss today is the topic of metabolic syndrome. This is a real problem among many of our patients with psychiatric illnesses, particularly people with significant psychiatric illnesses and little access to healthy food, opportunities to exercise, and who just don't have the opportunity to take care of themselves the way many of us would take for granted. What happens with metabolic syndrome, the basic cause of metabolic syndrome is something called insulin resistance. Insulin doesn't work properly, and even large amounts of insulin cannot reduce the levels of glucose in somebody's bloodstream. As a result, they're more susceptible to diabetes, they're more susceptible to heart disease, and they're more susceptible to strokes. And we see elevated prevalences of these very serious illnesses in our patients here at CHR, largely due to metabolic syndrome. Metabolic syndrome is not unique to patients at CHR. It's fairly common in the United States and other developed countries now, and it's a problem for many people. It basically involves kind of having an apple-shaped physique with a large waistline, 40 inches or more for men, 35 inches or more for women, elevated blood lipids, elevated glucose, somewhat elevated blood pressure, and being significantly overweight. And all these things kind of create a vicious circle. I mean, you end up with these types of characteristics. You don't take care of yourself, you don't exercise, you don't eat right, you don't have access to healthy foods, right? It gets worse, right? And then insulin can't do its job, glucose goes up, lipids get worse, you get heavier, your waistline expands, and it goes on and on and on. And as I said, the end result of this is an increased risk of an increased prevalence in our patient population of heart disease, various types, strokes, and as well, also type 2 diabetes, which in turn predisposes people to heart disease and strokes. So we need to be more aware of when people have these characteristics, when they're overweight, when their lipids aren't metabolized properly, when their glucose is elevated, when they have type 2 diabetes, right? When they have certain BMI or waist circumference, and they have difficulty managing these things on their own. We need to put things in place to kind of prevent the kind of heart disease, strokes, and other problems, diabetes, type 2 diabetes, that will result from this sort of an issue. First thing we need to do is know that this syndrome exists, right? And this is not straightforward in a mental health organization because we tend to talk to people, right? Not measure them or examine them, right? So what we need to do is we need to get vital signs, right, on admission and at certain intervals. We need to get certain laboratory tests, right, so we can see if there's a problem with cholesterol, with triglycerides, and with glucose. And we need to measure waist circumference to see if people are overweight. And then we need to be able to talk to people frankly, but in an objective, professional way, and help them to services that can enable them to reverse these problems. And there's no question that identifying the syndrome and intervening is worthwhile, because if you can prevent a heart attack, you can prevent a stroke, you can prevent a diagnosis of type 2 diabetes, that right then and there probably extends somebody's life by a number of years. And not only that, but the quality of life as well. So we have to be able to do these things. There's a special corollary in psychiatry that we need to talk about as well. And this involves some of the medications that we use. Despite our best efforts, our medications still sometimes result in side effects that need to be managed, or the medications need to be changed. Here at CHR, some of the more common medications that we use are called atypical antipsychotic medications. There's a whole variety of them, and some of them are more likely to cause problems with metabolic syndrome than others. But whenever we're using a medication like this, we need to be aware of the fact that we could be creating this problem or making it worse. So we need to measure blood glucose. We need to measure lipids on a regular basis. And we've installed, we've kind of automated getting this sort of thing. So with some of our recent changes to our medical record, and we need to get blood pressure, other vital signs, and waist circumference. And if we identify a problem like this, well, we need to refer them to integrated care, to their primary care physician, and we may need to refer them to wellness training as well. We have a situation where we have an opportunity for personal training and for going to a gym and being supervised by a personal trainer here at CHR. We have case managers and other people who can help people to find ways to have healthy food and to shop better and to cook so that they will have a better diet as well. And we can measure these things in these programs. We can measure progress or the lack of progress and change our tactics as necessary. Again, these things don't seem to be a major problem. Some people would say, why do we want to spend money on this kind of thing? You know, we're a mental health organization and, you know, every dollar only goes so far. Well, helping people to lose weight, helping people to eat properly, helping people to avoid metabolic syndrome, and to avoid cardiovascular disease, to avoid strokes, right? Heart disease and strokes, and to avoid diabetes is extraordinarily cost effective. So, and not only that, it's the right thing to do because, I mean, who would want to have a disease like this if there's a way to prevent it or to manage it so it doesn't get worse? So we're going to have to take on some of the responsibility for doing this here at CHR as a mental health organization that is involved in integrated care, working with medical practitioners and people who do preventive work as well. So this is going to be an expansion of our mission because you know, if we help people with their mental illnesses, they don't hear voices anymore, they're not feeling depressed anymore, they're not feeling as paranoid, it's kind of a Pyrrhic victory, right? If then they go on to die of heart disease when they're 45 years old. You know, I just think that we, you know, we can't consider that to be enough. We need to do more.